Okay, so what is it like to actually receive a ketamine treatment for depression? If you're working with a clinic, you would go in person to meet with a psychiatrist or a counselor to help you understand what to expect and to set any goals for your experience. Then you would come back on the actual treatment day where you would receive the medication in the form of an IV, a nasal spray, or a sublingual tablet. They would likely have you lay down on a sofa or a bed with a comfy blanket and an eye mask and some headphones. And someone would probably stay with you in the room to make sure that you're safe and to engage with you in any way that you need. But these experiences do tend to be pretty inward facing, so you may or may not want to engage with them while you're actually under the influence of the medication. The experience lasts for about an hour. It can be difficult to describe what it feels like, but some people describe it as transcendent. Others describe it as really challenging as they are facing and processing past painful experiences with a different perspective. Some people actually describe it as both transcendent and difficult, for what it's worth. And then after your initial treatment, you would stick around for a couple of hours just to make sure that you're stable and that you're able to process what you just experienced. And then in the days and weeks following, you would come back for a couple of what they call integration sessions. So you would work with, again, the counselor or the coach to help you process what you learned and utilize it in your regular daily life. These days, it is also legal for telemedicine companies to ship ketamine to your house. There is a lot of debate in the field about whether this is safe and wise and effective, but it has increased accessibility, and I know that it has been helpful for a lot of people. So if you're going to go that route, if you're working with a company that's looking for your mental health, they are going to take you through that same series of events. So you're going to have the preparation, the event itself where you have hopefully a sitter on hand, and then you're going to have the integration work afterwards. It's also important to know that ketamine does have some addictive qualities to it. So if you're getting it at home, just stick to the treatment plan that they gave you so you don't get into any of that mess. This is the third of 3 videos that I have made on this topic. If you want to learn more, you could check out the other 2 or click the link in my profile to read the full Forbes article. Please feel free to reach out with any questions about this or about anything else.